With daily attacks on Palestinians across Gaza and the occupied West Bank, Palestinian health systems, well, they're at breaking point. Power cuts, fuel shortages, a lack of basic medical supplies, just some of the challenges facing medical workers. And the challenges aren't just in hospitals. Even basic maintenance of ambulances is a daily struggle. Let's bring in our guest to compare and contrast what we're seeing in Gaza and the West Bank. Dr. James Smith is joining us from Al-Mawasi in Gaza. He is an emergency physician working with medical teams there in the Strip. And we have also Nisreen Qawas, a psychologist and director of mental health and psychosocial support services at the Palestine Red Crescent Society. She joins us from Ramallah in the occupied West Bank. Thank you both for joining us. So, talking about the West Bank, first of all, Nisreen, as parts of the West Bank now we're hearing face fuel shortages over the last few days. Today we heard about power cuts because Israeli occupation forces hit a power line. I mean, these are things which Gaza has experienced, right? Although in much greater intensity. How are medical services in the West Bank adapting and coping with that kind of scenario?
We are facing a hard time coping with the challenges that we are faced by the occupational all the time. Of course, it's escalated during the past 2-3 months, but it's on daily basis. What we are facing now is not allowing us to reach as ambulances where they should reach. It's hard. The roads are cut. The 1,000 borders that are made within the West Bank are closed when you never know when it's closed and when it will open. It actually all depends on the soldiers standing in front of the border. That is put in there. Add to that, there's a fuel crisis in all the West Bank. It's very hard to fill the tanks. In addition to the restricted movement that we are faced with as PRCS ambulances moving around, in addition to the fuel problem that was created by the occupation. Reaching there depends on getting a green light through the ICRC to reach where the wanted people are and to carry them out from roads that are not the original roads, but you have to take rounds and rounds to reach the places. Like 2 days ago in Tul Kerem, a case has to stay 1 extra hour in the ambulance, in the roads, trying to reach Thabit's hospital, which is the governmental hospital in Tul Kerem. Right. Another lady, the day before yesterday, gave birth on the closed border that was put in Nablus. She did not reach the hospital. She gave birth in the car, actually.
Right. And I imagine, Dr. James Smith, in Gaza, hearing some of these stories must touch a nerve for you. You've been in Gaza 3 times now. You've seen the situation there, I guess, develop over time. What has been the most important lesson that Gaza Medical Services have learned about resilience under fire, under occupation, under siege, under what the UN calls a genocide?
Well, Sami, I mean, the first thing to say is that I doubt very much that there is any other healthcare system anywhere in the world that could have withstood what the Palestinian healthcare workforce and Palestinian health system has been subjected to in Gaza over the course of the last 3 years. And that isn't something to be celebrated per se. That is an indication of the adaptation that Palestinian healthcare workers and Palestinian health systems experts have had to engage over the course of nearly 20 years of occupation. The ongoing deprivation of access to essential medicines, the inability to refurbish and expand hospital facilities. All of these different dimensions have demanded of Palestinian health workers continuous compromise and difficult decision making. That, as I say, has marked the experience of Palestinian healthcare professionals. And indeed, that's what we're seeing still to this day. I think it's very important for your listeners, many of whom I know have been following what's being done to the Palestinian people for a very long time. But the violence continues. As you reported in your introduction, airstrikes over the last 12 to 24 hours, at least 8 Israeli airstrikes, many people injured in those strikes. And of course, access to basics, the most basic medical equipment and medications. And here I'm talking still about gauze and paracetamol. These are the same things that I alerted the world to, that many of us alerted the world to back in December of 2023. They're still in extremely short supply because Israel continues to titrate access to all of these essential items.
When we listen to what Dr. James Smith has just said there, I'm wondering, Nisreen, is it possible for Palestinians in the West Bank to learn from those lessons of resilience, to stock up maybe on some of the things which Dr. James said in advance, for paracetamol, gauze, these kinds of things, in anticipation of the levels of what the UN calls state-backed settler violence and military violence increasing in the West Bank?
We learned a lot from Gaza's experience. We would have loved to learn about resilience in a very different way, but what we have prepared ourselves to is a high level of escalations in the West Bank, so that in the West Bank now we have 85 medical points spread across all the West Bank, PRCS medical points, in addition to 4 mobile clinics that are one in Hebron in the south, one in Ramallah, around Ramallah Governorate and villages, one in Jordan Valley, and another one in Jenin, around covering all the area in Jenin. But that does not mean that we prepare, but that does not mean that we will be ready, because we don't know to what extent the escalations will happen. We don't know. As I told you, there are more than 1,000 gates around the West Bank, and when the gate is closed, it is closed for everybody. They do not give a green light for the ambulance or the pre-medics to pass to help cases. Fuel is another big problem. The Ministry of Health has stocked medicines, but in our meeting yesterday, they said that there is 120 kinds of medicines that are not available.
Right.
And we are talking chronic diseases as much as we try to prepare, but the obstacles are still higher and unanticipated to which level they will go.
Right. I think we've got a couple of minutes left. So let me go back to Dr. James Smith in Gaza. You mentioned that the airstrikes continue. We cover that every day. Has there been any improvement then in the situation for medical workers, for medical services there in Gaza since that ceasefire was announced, at least on paper?
No, I don't think so, Sami. I mean, you could argue that perhaps the frequency of attacks has diminished, but we're talking about more than 200 security incidents almost every single week on average. Most of those incidents are Israeli airstrikes, Israeli artillery fire, fire from the Israeli warships just off the coastline here that you can see as you're traveling to and from work. There is the constant presence of the occupation and the constant.
But Dr. James, what I'm getting at, in
violence.
addition to the strikes, though, the ceasefire agreement was supposed to see increased flow of the necessities of life into Gaza. Are you getting the medical stuff you need? Has that been coming across in the amounts you need it?
No, absolutely not. And again, this is where strategies of misinformation and disinformation run rampant, because the numbers don't reflect the reality on the ground here. The United Nations have reported very clearly that the volume of aid trucks per the UN 2720 system fall far below the agreement of 600 trucks per day. Israel has responded saying that a significant number of commercial trucks are entering Gaza. But what we then have to ask in return, if we think about food, for example, if you see food on the market, that doesn't mean that people aren't hungry. That doesn't mean that people aren't suffering from malnutrition. If people can't afford food, if there's no fuel to turn the burner on to cook food, if there's no access to clean water, then all of these things are a veneer of humanitarian concern.
All right, we're going to have to leave it there. Let's thank both of our guests. Dr. James Smith is joining us from Al-Mawasi in Gaza, an emergency physician. Nisreen Qawas, a psychologist and director of mental health and psychosocial support services at the Palestine Red Crescent, joined us from Ramallah in the occupied West Bank. Thank you, both of you.